In this segment, I'm going to demonstrate an articular dysfunction treated by muscle energy for an occipitoatlantal dysfunction that is flexed, side bent left, rotated right. Because it's flexed, I'm going to try to find an extension barrier. So you'll use your motion, testing, etc. to come up with that diagnosis, but because of the extension restriction, we're going to bring this patient into extension, into that restrictive barrier. Because it's side bent left, we're going to take the patient, tilt the patient a little bit in that OA articulation, motion available for side bending to the side bending right barrier. And because it's rotated right, we're going to rotate to a rotation left barrier. And when we get to that three-plane diagnosis and three-plane positioning, we're going to hold the patient there. And now, because we have a restriction in extension, we're going to use extension as our main mobilizing force here. To have a post-isometric relaxation technique, the physician moves into the restriction, PIR. Therefore, to get him to move into a restriction of extension, I have to take my two fingers under his chin, right here in the anterior jaw area, and have the patient push into my two fingers here. So push into my two fingers and relax. And after he relaxes against these two fingers here, we bring him back to his new extension barrier. Then I have him push back into here again and relax. And that's, the 3 to 5 seconds typical of muscle energy. Be careful when your hand is here that you don't get hyoid, cricoid, or thyroid cartilages, that you just catch the lower mandible. And try that one more time, 1001, 1002, 1003, and relax. And we get into that new barrier. Now, if this patient has a temporomandibular joint problem, we still want to carry him back into extension, but we might not want to be jamming up his teeth in the approximation of his bite and putting compression into his TMJ. So therefore, I could take my hand, move it up to his forehead, and just push gently back on the forehead, and using this hand and kind of come up a little bit to meet that extension barrier. And then have the patient try to push his chin to his chest, and I resist that. And relax, and after he's relaxed, I just take him further back up. So again, just gently bring the chin towards your chest. And he tries that, and I resist that. And relax, and I can do that, so on and so on as the extension barrier continues to move. The under the jaw resistance gives you a little bit further distance from the occipitoatlantal articulation and gives you a little bit of a longer lever effect, which might make it slightly more powerful and, in general, easier to control. But that was a post-isometric relaxation technique, positioned into the restriction, or using that mnemonic device, PIR, for an OA, flexion, side bending left, rotation right dysfunction.